Do you know many women have heart attacks but don't even realize it, because few of them have heart attack but they do not have any chest pain, unlike that of men. Men usually presents with chest pain if they are having a heart attack, but females may not have a chest pain even if they are having a heart attack. I am Dr. Arup. I am an interventional cardiologist. Today I will be discussing about how women present with heart attack. What are the 7 symptoms they present with and how to recognize these symptoms so that you can take an early diagnosis and early treatment and improve your outcome. And kindly share this video with your either mother or sister or your friend so that it could be life saving for them as well. So the alarming reality of cardiovascular disease in women is that we tend to think that women are protected from cardiovascular disease or heart attack. That is partially true. Till menopause, the women are protected from heart disease or heart attack. But after menopause, the risk of heart attack or heart disease increases even more than the male. In fact, it has been shown that the women die of more of a cardiovascular disease than all the cancers combined together. So women are actually at risk of cardiovascular disease, especially after the menopause. But even though, not only that, even before menopause also, women are nowadays suffering from heart attack because of the emergence of diabetes. If a woman is diabetic, even though she is a premenopausal, she can develop a heart attack or heart diseases. So why the heart attack gets missed in women very commonly? There are various reasons for that. One reason is a medical reason, which we have discussed, because the women present to us most often not with chest pain, with some other symptoms. So that's why it tends to get missed, or the diagnosis tends to get delayed in women. If the diagnosis is delayed, treatment also tends to get delayed. So one is medical reason, because of their presentation, because of their atypical presentation, because most of them do not present to us with a typical chest pain as men's do. And second is a social reason, because women usually they are caregivers of the family. They tend to care for their families more often their own health. So their own health takes a backseat most often. So that is another reason, the social reason, the women tend to take less care for their health, and that's why their symptoms and their treatment tends to get diagnosed and treated late compared to men. But the alarming reality of women with heart attack is that up to 50% of the women with heart attack, they do not have chest pain. They tend to have a silent heart attack, and this silent heart attack is quite dangerous. That we'll discuss later. So kindly comment on the comment section below that apart from women, which all are the group of individuals who can have a silent heart attack, because silent heart attack is very dangerous. Since silent heart attack do not have a typical presentation, they tend to be diagnosed later on. They tend to come to us or to any doctor quite late, and that's why their treatment also is quite delayed, and their prognosis or outcome is also not good. So that's why knowing silent heart attack is very, very important. So kindly comment on the comment section below as which all group of individuals can have a silent heart attack. So why silent heart attacks are so dangerous? Because they have a delayed presentation and they seek delayed treatment, and that's consequently their mortality is higher. Their outcome is not good. The recurrence rate of heart attack is also more, and their intervention rate is also less compared to male. So what are the symptoms of a heart attack in women? If they do not present to us with a typical pain, how do they present to us, the women? So these 7 symptoms are as follows. The number 1 symptoms, the chest pain may not be very typical as like that of a male. Male present to us with usually very heavy, squeezing, severe degree of chest pain. But women may not present to us with a very severe degree of chest pain. They can present with very mild or no pain at all. And sometimes they tend to think this pain is because of some muscle ache or some stress related things. So that's why they tend to it gets ignored most often than not. So number 1, they tend to have very mild pain or no pain at all, which tends to get misdiagnosed. Second, they can present to us with shortness of breath, and this shortness of breath, especially if it is sudden in onset and it is unusual, like it is happening even with day-to-day activities like climbing stairs or doing day-to-day routine activities. If there is a shortness of breath along with if there are giddiness like features, then it strongly suggests probably there is some cardiac related problem or heart blockages. But most of the time all those things gets misdiagnosed as asthma or lung related issue or fatigue, this shortness of breath. So if there is a sudden onset severe shortness of breath, especially with normal day-to-day activities, then you should be aware of. Third symptom they usually present to us with is unusual fatigue or weak. So women dismiss it as a household stress, but if it is sudden onset severe degree of fatigue, it also could indicate that probably it's heart related issue. So unusual sudden onset severe degree of fatigue also could indicate that it could be a heart related issues. Fourth, it could present, the heart related issues or heart attack could present in women as a GI related problem or gas related problem like indigestion or heartburn or upper abdominal pain or feeling of nausea and vomiting. So they tend to get misdiagnosed as a GI related or gas related problem. That's another form of presentation in women. Fifth, which is also not an uncommon presentation in women, is pain in other areas apart from chest. Like it could be, the pain could be in the throat, or it could be in the jaw, it could be in the back, upper back. So especially I have seen people who are having a jaw discomfort and they have gone to various doctors including ENT doctors, and ENT doctors haven't found out any abnormalities, and ultimately when they visited us, we have found out that jaw discomfort is due to heart related issues. So jaw discomfort is not a very uncommon presentation in women. Along with that, if there are other pains in other parts of the body like in the upper arm or in the back or neck, it also could indicate this probably is a cardiac related issue. Sixth, symptoms which they could present to us with is sweating and lightheadedness. Especially the sweating is a cold sweat. Women's after exercise they tend to have a sweating, but this is usually associated with warm. But if there is a cold sweating, the skins are cold and clammy, and if there is associated with sweating, it could indicate probably is a heart attack. Another common reason for sweating in women, especially perimenopausal and postmenopausal women, is because of the menopause itself. The menopause itself causes sweating, but that usually is warm sweating. Women will complaining of sweating, excessive sweating along with feeling of warm. But if the women complains of excessive sweating along with feeling of cold clammy skin, usually it indicates probably it could be cardiac related. And seventh symptom which the women could present to us with is flu related symptoms like generalized malaise or body ache or mild degree of fever, and ultimately it could be a cardiac related issues and feeling that something is not right. So all those are symptoms which women can present to us with a heart attack, but they may not have a chest pain, and if we need to be wary of those symptoms. So especially women should be aware of all those symptoms, and especially if they have risk factor, if they are diabetic, if they are hypertensive, if they are having high triglyceride and cholesterol, if they are having family history, and if they have all these atypical unusual symptoms, then they should not ignore it. And especially if they are feeling that something is not right, then they should not ignore it. They should always take an immediate medical care. Then you should go to a nearby healthcare facility. They at least should do an ECG and do a blood investigation like a troponin, and they should visit a cardiologist. And what are the key takeaways in this presentation? The chest discomfort or heart attack, chest discomfort in women may not be always there in case of heart attack. They present to us in various different ways. First of all, they can present to us with very mild or no discomfort at all. They can present to us with shortness of breath. They can present to us with other features like gas related issues. They can present to us with giddiness or palpitation. So there are various form of presentations. So they need to be wary of all these symptoms, and they should take a good care of their health. And how they should take a good care of their health? They should do a regular health checkup. They should check their blood pressure, they should check their sugar, they should check their cholesterol, they should go for a healthy diet rather than taking a fried food. They should go for a healthy options like millet or dahlia or oats. They should remain healthy and active. They should go for daily exercise at least 30 minutes a day. They should prioritize their sleep. At least 7 hours of sleep should be done every day, and they should listen to their body, and although they are caregivers for the family, they should take care of their own health as well. So all those symptoms, as we have discussed, should make one's wary that probably is a cardiac related, like if they have subtle chest discomfort or shortness of breath or extreme fatigability or GI symptoms, indigestion or dyspepsia or heartburn like symptoms or throat pain or jaw pain, especially cold sweats and fainting and flu like symptoms. If all the symptoms are there in women, it could be a heart related issues. So go and visit to your nearest doctor. So if you like our video, kindly share this video with your either your mother or a sister or your friend, so that it could be life saving for them. And if you like our video, kindly like and subscribe to our channel. And if you like this video, you should also see this video which we discuss about that all chest pain are not due to heart attack.